Thank you, sir, for your nice introduction. Good afternoon, friends. Uh, as you know, customarily and conventionally, we divide the human population into two gender, male and female. And today, I am going to talk against this customary classification, and I'll talk about non-binary approach to the gender. For this presentation, I do not have any conflict of interest. I treat only adult patients, and all the persons shown gave explicit consent that their pictures could be used. So I'll go through the few agendas. I'll give a short introduction about my talk. I'll discuss about my experience with this kind of people, and then I'll talk a little bit about the third gender, then the health risk, and the take-home message for the presentation. Now, this is the case I have seen roughly around 2 decades back in our endocrine clinic. And by looking into this person, I thought there is something abnormality, and I thought that there must be something problem in this individual. So I could not make out at that point of time. So I asked this person to undress, and after undressing, I found that actually it was a complete man, and this is the first time on first exposure, as far as myself is concerned, about the difference between the gender expression and the biological sex, which may not match always with each other. So if I ask this simple question, how do you describe your gender, then majority of us will not have much problem answering into this straightforward question. So we we can answer this question, but some of the people are actually confused. And if you ask this same question, then they can have a varied answer. Some of them can tell you that I just don't have a gender. So the gender as varied as people, and you cannot just tell from looking into them, as I have already shown you. It is often complicated to figure out and cannot know the identity unless you ask. So therefore we have to ask. This is a very important learning, that we have to ask about the gender. We cannot assume the gender of a person. Now, so coming to the concept of gender non-binary, we often give a term gender queer. It can be used almost synonymously. So this is basically a spectrum of gender identities that are not exclusively masculine or feminine identities. It is basically an umbrella term under which actually we keep all the people, those who are outside the binary of female and male. Anyone whose gender identity is outside male or female, we can keep under this terminology, this umbrella term of gender binary, gender non-binary, or the gender queer. Now the issue is that many of them actually face a very, very important social challenge when they come across to a restroom, when they have to use the restroom in the public. So that is a very, very important challenge in front of them, because every time they have to force to uh, to, tell about the gender in public, and every time, all the time. And choosing a bathroom is almost synonymous to the choosing a gender, which creates an exhausting, continuous anxiety. So with this small introduction, I'll discuss about my experience, as because we run the first transgender clinic of the Eastern India in our hospital. So because of this clinic in the hospital, I came across to many people who have different kind of gender identities. Now, most of the patient what we see and deal in our clinic is basically transgenders, no doubt about it. So transgender may be of two, transgender woman and transgender man. And transgender woman has got a chromosomal sex of XY. They have gonadal sex of testes. They have male genitalia, but they perform a female gender role. On the other hand, transgender man has got a chromosomal sex of XX. They have ovaries, female genitalia, and they perform the male gender role. They feel that they are entrapped into a wrong body, into a female body, but actually they are man. These transgender people constitute the majority of the people we see in our clinic. Now, this is a young man who came to us for the transition therapy, and we treated this patient with the hormone therapy, and then he underwent through the gender affirmative surgery, and you can see over a period of time there is a complete transformation, and we call them transgender women, or you can call them as trans feminine. Just the reverse, we have another young women who came with an unsuccessful breast surgery. Then we advised her to go for a redo surgery of the breast. We treated this patient with testosterone therapy. She underwent the gender affirmative surgery, and now we can call them as trans masculine or transgender man. Now, these are the common example I think all the endocrinologists have seen in their clinical practice. Now, this is a 32-year-old from Bangladesh consulted our endocrine clinic for female hormone therapy. She ran away from her family at the age of 16 and joined a Hijra community. She underwent castration 14 years ago by a quack inside the Hijra community quarter in a remote village of Bihar. And you know, these people, they actually undergo very bad quality of surgery, and the castration was done by the quack. And I can show you the picture, and you can see that they are left with no genital organ. So these are the very common experience of us, and we see majority of these patients are coming from the Hijra community. Now, this is a young boy came to us in 2001 with puberty gynecomastia. So his parents were quite anxious about the puberty gynecomastia, but he was not very apprehensive about the gynecomastia. Now he left our clinic, and he came back in after a decade in 2010. But at that point of time, I found that he was quite depressed, confused about his identity. So I asked him to go and consult a psychiatrist. So I had the uh, diagnosis of gender dysphoria, which actually at that point of time we used to call this term as a gender dysphoria. So he consulted a psychiatrist, and the diagnosis came. So we actually subject him to the hormone therapy, and then he underwent to the transforming surgery. And as you can see, in 2013, after the hormone and gender affirmative surgery, it appears that she was quite happy with the process and the transformation. Now, this is another young person with trans masculine who started the hormone in 2011 at the age of 20, and mastectomy done 2012. Nothing novel in it, but the issue is that he came to me in the follow up with his girlfriend. Now, in 2015. Now, if we look into these two young person, and in perspective of their identity and the attraction, you will find that this is basically a transformed or the transgender man. So transformed from female to male, biological sex is female, gender identity manness, and sexually attracted to women. This is a complete female, biological sex is female, gender identity woman, and sexually attracted to masculinity and not man, because he is not a complete man. Now, coming to this example, Miss SS, 20 years, a student of comparative literature, assigned female sex at birth, sexual orientation female, mentally and physically attracted to female, and her mother was worried because of her this kind of behavior. She was not interested to change her gender. She was not transgender. She had anxiety and thought herself alone and insecure, which is a very common problem among these group of people with depression and anxiety. You can understand that she is basically a lesbian. Now you can see this 20-year is a boy came to us, uh, and he demanded that he was actually gay. He assigned male sex at birth, sexual orientation male, mentally attracted to male, and disliked interacting with women. His mother was worried because of his behavior. He had no anxiety, but he was a huge challenge for his parents. Now, this is another young man at the age of 20 came to us. He had a tendency to talk excessively and he had a woman-like behavior, woman-like walking and gesture, and physically attracted to female. His mother was worried about the hormone defect, and she told me that he must have less amount of male hormone. So, doctor, you give some male hormone so that he becomes complete man and he don't behave like a woman in front of the others. He was bullied by the peers since adolescence for the female mannerism. Not interested to change his gender. He was not transgender, but he had that kind of behavioral problem. But the issue is he had suicidal attempt twice, and that is an important challenge in front of us. This is Miss Air, 26-year-old lady. She was diagnosed as congenital adrenal hyperplasia with salt wasting crisis at 10-day age, karyotype 46XX, clitoroplasty done at 2 years of age, and she was reared as girl. She had a spontaneous puberty at 12 years. Now she desires to be male and adopt a male typical behavior. This is an important challenge for the congenital adrenal hyperplasia patient who underwent the clitoroplasty at a very young age. And now sometimes we face this situation, and therefore many people raised this issue that whether male sex rearing is a good idea for the patients with congenital adrenal hyperplasia with XX background. Now, this is another interesting young couple, and you can see this lady came to us for transformation to a male, and this young boy came for the transformation as a female. Now, while coming to our clinic, they get romantically attracted to each other. Now, if we look on the perspective of these two young fellow, as far as their identity and attraction is concerned, this is a person who actually transforming from female to male, undergoing the hormonal therapy at present. Biological sex is female, gender identity manness, and romantically attracted to femininity, not female, because it is not a female, it is not a complete woman, but she is attracted towards femininity. On the other hand, if you look into this person, biological sex is male and gender identity is womanness, and romantically attracted to masculinity, but not a complete man. Now we have a further complicated relationship in this couple. Now you can see this is a boy who wants to transform as a girl, and having the long hairs, and actually has a girlfriend. And you can see that this is he wants to transform from male to female. So biological sex is male, gender identity is womanness, and they are usually attracted towards male. But here this person is romantically attracted to a female. Now, if we look on the perspective of this young girl, you can see biological sex is female. She's completely normal young girl, and gender identity is womanness, but she is romantically attracted to both sex. So there is the issue, and that is why they are actually together. Now, with this in examples, if I ask this question, how many types of gender we have, then we can see that we have the we have the two important extremes. One is the man and the woman. They are the two extremes. In between these two, we can actually place the trans masculine and trans feminine. But even if we look into this, then actually it is a approach is binary. So if you look into the man and woman, it is binary. If you look into trans masculine and trans feminine, then also the approach is binary. But within this frame, between this man and woman, we have to place all these individuals. And therefore, the concept of non-binary comes, and all these individuals actually comprises roughly around 0.5 or 0.6% of the total population. So if you consider the total number of world population or even the population of India, then 0.5 or 0.6% will be a huge number. So coming to the concept of the third gender, as you know, that the concept of the third gender is not new. The concept of the third gender was there since ancient time, and we can see these pictures. We can see many mythological character. we can see it in our sculpture, you can see it in our temple, you can see in our art, that this third gender was existed since ancient time, and people were aware about a concept of a gender which was the beyond the conventional male and female. And this concept of third gender not only present in the eastern part of the world, but it was present in the western part of the world as well. As you can see, this is a Greek marble of 2nd century BC, and the figure shows that the presence of the breast and penis in the same sculpture. Now, you must have seen these people in the roads, and these people are the Hijra community of our population. And this Hijra community, actually, many of them actually transgenders, but I exactly don't know the composition, and nobody has worked in detail as far as their exact composition is concerned. But I expect that there are this is not a homogeneous population. This is basically heterogeneous population. We have the transgenders, there is a transvester, there may be intersex disorder, and there may be many other varieties as well. Now, if we look into the concept of the transgender, hijras are the officially recognized third gender in India. And as I have already told you, that the intersex disorder also come under the heading of third gender, as also the transvester and transgender. Sometimes we give this terminology gender queer, or we call it a rainbow community. So anybody, as I've told you, not heterosexual or cisgender, will come under the heading of this gender queer variety. And therefore, these four important groups, the lesbian, gay, bisexual, and transgender, definitely comprises the major fraction of the gender queer family. But the issue is, we don't know the sexual identity of the many, and therefore we keep it as a questioning. And we also know some of the people have the two-spirited, there are evidences. So now the community extends to LGBTQ2, and now if we add the intersex disorder, and there are some people are actually asexual, and there are some ally those who work and talk about the transgender. So the spectrum actually increases to LGBTQQIAA. And also we have some bigender people, those the identity moves between feminine and masculine gender and behavior over a period of time. So it is a long list of people. This may not be the complete list, but it is a long list. So we cannot just identify the whole humanity, or can classify the whole humanity between male and female, or we cannot classify just the between the male, female, and trans men and trans women. So if we look into this important cartoon, that will give you an idea that how we should look and approach into this important area of issue. Now we have to identify, there are three important points. One is the biological sex, which is very easy to understand. And second is, what is the identity? And identity actually is inside our brain. And third is the attraction, sexual or romantic. So these are the three important parameters which we have to understand as far as each and every individual is concerned. And all three actually should remain aligned if you are not transgender, if you are cisgender and heterosexual. But if you are not heterosexual, if you are not cisgender, these three will not remain in alignment. Though these three also importantly influences the gender expression, but it may not match with each other. So therefore, if I look into this spectrum of the people or spectrum disorder, it is something rainbow. So they actually varies from one to other. And if we put them into the two extremes, straight male and straight female, and if I keep in the middle the questioning group, where the identity and attraction is questionable, and we have lot of shades in between, from gay to bisexual to transmasculine to asexual, female asexual, then transfeminine, then bisexual, female lesbian. So there are a lot of shades in between, and therefore we cannot make a simple statement of male and female or trans men and trans women. So why we should know about it, why we should learn about it, this is the question. And because of the fact they have lot of health issues. Now if we look into the prevalence of type 1 diabetes in our country, it is roughly around 1 lakh. And if you look into the census, last census done in 2011, and if you look into the total number of transgender population in our country, it is roughly around 5 lakh. Now this is 5 times more, though I say that it is grossly underestimated. If you think that the prevalence is roughly around 5%, 0.5 or 0.6%, then the number will be huge. Anyway, even if it is 5 lakh population, then it is 5 times more than the type 1 diabetes. Every physician knows a little bit about the type 1 diabetes, but very few physicians understand the transgender issues. Now, most of the research on the transgender health tends to consider transgender individuals as belonging to a homogeneous population and stratify as trans women and trans men, a very wrong way to approach. They are target of oppression, discrimination, and stigmatization, leading to negative mental health and physical health outcomes. They perceive mental and medical health professionals are unfamiliar with non-binary genderqueer identity and their needs, and a very, very correct statement. And as I've told you, most of the physicians don't understand their needs. So if we look into the psychological issues associated with non-binary genderqueer people, this publication came in 2019 and looked into the prevalence of different mental health problems among the genderqueer people. You can see that the post-traumatic stress disorder, anxiety, depression, bipolar personal disorder are very common among them, especially the anxiety and the depressive disorders. They are they are they have lot of substance abuse disorder as well. Not Apart from smoking, the alcohol and cannabis use is very, very common among these people. The most important challenge in front of us is the suicidal thoughts and behavior. This again a systemic review published in 2019, and it shows that the roughly around 46% people actually have the suicidal ideation, and 27% actually had a suicidal attempts. This is an average figure all over the world. And if you look into the our data, we have very little data from India, and we have this statistics of 31% transgender person had a suicidal attempts. So this is basically very close to the world data we have. So coming to the issue is how we should help these people. We have to help these people to make the transition, and transition actually two part. One is integration and alignment. Integration means the process of finding comfort in oneself, and alignment means you have to align the public gender with that of the private gender. As you know, public gender is quite visible from outside, but the private gender is inside, that is inside the core of our mind. But sometimes the public gender may not exist, and how to approach if the person do not have any public gender. In that case, we have to try our level best to close it to the level of comfort as far as the particular patient is concerned. There are a lot of challenges in the transition because it is quite unique for every individual, and it is uncertain. As far most of the people are very, very uncertain about their destination, and not only that, they keep on changing their destination, so the goals are not static. So how we approach as far as the management is concerned, we have to understand the client goals. We have to understand the compromises, the amount of compromises that they can make, and at the same time that how much hormone therapy and the transgender and the surgery can actually help. And we have to work with uncertainty because the goal changes, and therefore their journey also changes. Now, medical transition does not legitimize or delegitimize anyone's gender, because you know very recently the Nalsa judgment came in 2014, and Supreme Court has given this the right to self-identification of every individual about the gender as male, female, or third gender. So the take home of today's presentation is that no non-binary genderqueer identities should be recognized by the healthcare service system. Specialized training for healthcare providers to become gender literate is the need of the hour. Guidelines should be revised, including not only the options for trans women and trans men, but also options for other genderqueer people, as well as giving clients the option to qualitatively describe their own gender self identification. Create a welcoming clinical environment, not only for transgender individuals, but also for non-binary genderqueer people, all non-binary genderqueer people, to disseminate right information and reduce the health risk. So I'll conclude by taking a line from Tagore, Aro alo, ei noyone, prabhu dhalo. Thank you very much for your patient listening.